in this video, let's discuss the following topics based on the given keywords, starting with soft tissue assessment, lateral cephalometry. So as you know, both skeletal and soft tissue cephalometric analysis can be performed on lateral cephalograms, and also the British Orthodontic Society recommends the use of cephalometric radiograph only for specific cases rather than for a routinely pre-treatment diagnostic evaluation. So let me know what the question is in specific. So if necessary, I'll update additional information in the description part of the video. So next question, I got these keywords epitope and paratope. So as you can see in the image, you find both epitope and paratope, and epitope refers to a specific target against which an individual antibody binds, whereas a paratope, also called as antigen binding site, is a part of an antibody which recognizes and binds to an antigen, right? Now, next question, as you know, growth hormone is secreted by anterior pituitary. So, growth hormone, also called as somatotropic hormone, the source of secretion is somatotropes, which are eosinophilic cells of anterior pituitary. Now, moving on to the next question, bilaterally symmetrical tooth. So I'm sure you're all aware of. So it's mandibular central incisor, and also we have another tooth. So can you name any another tooth which is also bilaterally symmetrical? It is mandibular second premolar. So as you can see in the image, mandibular central incisor, mandibular second premolars, they are bilaterally symmetrical. Consider this very, very important. Now moving on to the next question, common location in jaws where you find metastatic jaw tumors. So based on literature review, here is some information. So the metastases from primary cancers are more often to long bones, vertebrae and ribs. The metastases of malignant tumors to jaw bones are very uncommon and account for approximately 1% of all malignancies of jaw. The most common location is the molar region of mandible, followed by premolar area, followed by angle ramus area, followed by condyle, and the least common being the coronoid process, right? Now, let's move on to the next question. Where do you hold a curved needle? I mean, if any one of you have done suture, then you can answer this pretty conveniently. So, at the junction of anterior 2/3 and posterior 1/3 for greater stability. So, as you can see in the image, right, we have a needle holder. So, greater stability is achieved with needle holder at junction between anterior 2/3 and posterior 1/3 of needle, right? Moving on to the next question, Trotters Syndrome. So one of you gave me a keyword saying that there was a question related to Trotters Syndrome. So here are some features pertaining to the same. So in differential diagnosis of trigeminal neuralgia, they are given this additional information pertaining to Trotters Syndrome in Schaeffer's. So tumors of nasopharynx can produce similar type of pain. That is, we're talking about trigeminal neuralgia, generally manifested in lower jaw, tongue, and side of head with an associated middle ear deafness. This symptom complex caused by nasopharyngeal tumor has been called Trotters Syndrome and was found to occur in 30% of a series of patients with this type of neoplasm as reported by Olivier. These patients also exhibit asymmetry and defective mobility of soft palate on the affected side, right? So this is some information pertaining to Trotters Syndrome. Moving on to the next question, why do you see bleeding in leukemia? Was that the question? So you find anemia as well as thrombocytopenia most commonly associated with acute leukemia. So anemia and thrombocytopenia are both characteristic of acute leukemia. As a result, in some instances, both bleeding time and coagulation time are prolonged. The tourniquet test is usually positive. Moving on to the next question, enzyme inhibitors in glycolysis, which we discussed in classes. So as you can see, in case of phosphofructokinase, the allosteric inhibitors include ATP, citrate, H+ ions, that is low pH, and allosteric activators include fructose 2,6-bisphosphonate, ADP, AMP, and inorganic phosphate. Remember, phosphofructokinase is an allosteric enzyme regulated by allosteric effectors, which we discussed now. And coming to enolase enzyme, the competitive inhibitor of enolase is fluoride, which is very, very important. Do make a note of it. And also in regard to lactate dehydrogenase, we have another competitive inhibitor, that is oxamate, right? So these are some of the inhibitors associated with enzymes or which inhibit the activity of enzymes related to glycolysis. Consider this very, very important. Now moving on to the next question, the final question, Marfan Syndrome, high arched palate is one of the radiographic features. So as you can see, Marfan Syndrome, also called as Marfan-Acrad syndrome, syndrome or arachnodactyly. The radiographic features include, especially in skull radiographs, AP as well as lateral views may demonstrate a high arched palate, increased skull height, and an enlarged frontal sinus. And also do make a note that this Marfan syndrome is isolated to FBN1 gene on chromosome 50. So as you know, in every exam there is at least one question related to genes. Right? So this is some information which I wanted to discuss in this specific video. Again, do let me know if you need any additional information. I'll update that accordingly in the description part of the video. I hope it's clear. Wish you all the best. Love you all.